Hey everybody, it's Caitlin. Welcome back to CoronaChat. Today is Thursday, August 13th. And with the school year here in the Northern Hemisphere and certainly in the US, either already started or about to start, we wanted to take the opportunity this week to talk a little bit about what we know about COVID in kids. We've talked a little bit about COVID in kids before on CoronaChat, but there's new information, and at the start of the school year, it seems like this is a really, really timely topic for us to take on again, and kind of share some of the updated evidence. And we mentioned this last week, but just wanted to say again that after tonight's episode, CoronaChat will be taking a 2-week staycation hiatus, just to give our team a little bit of a chance to kind of rest and recuperate, and start gathering evidence and getting ready to do this whole thing again starting in September. So just wanted to give you all a heads up. If you're not already following our Facebook page, which is www.facebook.com/Caitlin Rain Williams, CaitlinRainWilliams, we'll put that link in the show notes. If you're not already following us on Facebook, you can access all of our content there, and we'll be making sure to kind of post some additional articles and things like that while our chats are offline. But all that said, you tuned in tonight for information on COVID in kids, and so wanted to kind of dive into that topic. And there's a lot of kind of conversation that's been happening in the broader public health community about what information do we know, what are kind of the risks to kids of being in school, risks to kids of being out of school. We have a lot of information about the detrimental effects or the negative effects of kids missing school. Everything from, not having interaction with their friends and, people to play with, to missing out on really important learning and growth opportunities, to, issues around actually being able to have enough food to eat, right? That lots of kids rely on their schools for free breakfast and lunch programs to make sure that they have enough to eat. So there's really kind of a range of different kinds of issues around not going to school. But what we don't have good information about is, well, okay, so if kids go to school, how likely is it that they're going to get COVID? And so, the latest information that we've got is coming from a new preprint that was published, I guess it was put online on MetaRxiv, which is the kind of preprint site. I'm just looking at it here. Looks like it was posted July 28th. So, we've talked before about how with preprints we kind of have to take them with a grain of salt. They have not yet been through the peer review process, and this is no exception. But we wanted to share the data from this particular preprint because reading it closely, it seems like the authors have been fairly rigorous in the way that they've approached developing this paper, although there are things that they could have done to have made it a stronger paper, and it will some of those things will probably be worked out in peer review. But given that the peer review process can take a long time, we're going to go through some of the preprint findings. And so this study comes to us from a joint team from the US and the UK, and what they tried to do was look at all of the things that have been published so far about COVID, and specifically kind of COVID infection and COVID transmission that affects kids. And importantly, what they did in this review was look at not just kids, but kids as compared to adults of different ages, right? And they tried to look at kind of different groups of kids and look at, really little kids versus teenagers versus young adults, right? To kind of give us a range of like, what is the impact of COVID on different age groups. With a lot of information about COVID and older people, we know that older people, if they get sick with COVID, tend to have really bad outcomes. There's a high chance that they could die. But what do we know about these other age groups, right? And so what these authors did was they did something called a systematic review. And a systematic review basically means that you try to go out into the world and find everything that's been written about a topic, or as close to everything that's been written about a topic as you possibly can, and then apply a very systematic process towards saying, like, well, what am I going to read in full, right? And how do I judge the quality of what it is that I'm reading in full? And the idea here being that, if you read one study, if you read two studies, right, one study could say one thing, the other study could say the other thing, and how do you know which one to believe, right? But if you read hundreds of studies about the same topic, you start to get an idea of kind of where it seems like the science is, where the consensus in the field is. And it gives you a better idea of, which one of those first two studies was correct, right? So these authors did a systematic review of the literature, and they looked at things that have gotten through the peer review process, but they also searched these preprint services to try to look at the things that have not yet gotten through peer review, so that they've got kind of the most up-to-date information that they can to include in this review. And I'll post the link to it in the show notes for any of you who are interested. I think particularly reading kind of the background and introduction section and the discussion section, if you're not a public health person, can kind of give you the, like, these are the key takeaways from this study, right? But what they found is that, yes, we know that older people are more likely to be very, very sick if they get COVID. They also seem more likely to get COVID if somebody else who's in the house is sick. So what these authors tried to look at were studies where we have actual contact tracing data, right? We know this is the person who was sick first, these are the other people that they were in contact with, and who got sick when we gave all of those people tests, right? So this is kind of the best, most rigorous way to know, okay, if everybody got sneezed on, like or coughed on, who is most likely to be sick, right? And so what they did in there is look specifically at this contact tracing data. And what they found is that, older people in the household are more likely to get sick if somebody else in the household gets sick. But kids actually seem to not get sick. So even if one of their parents gets sick with COVID, kids seem to be less likely to get sick from that person in the household who has COVID. There's lots of reasons why this might be the case, right? Some of this might be because kids' immune systems are a little bit different. Some of this might be the fact that, two adults might be, a couple, and they might be sharing the same bed, right? And so they're breathing in that same air all night when they're asleep. And so it makes it more likely that they're going to transmit it as opposed to a kid who's sleeping in another room, right? So we're not exactly sure why it is that kids are less likely to get sick. But when somebody in their home is sick with COVID, kids seem to be less likely to get sick. The other thing they looked at is, well, what happens if the kid is the first one to get sick? How likely is it that the other people in their household get sick, as opposed to if the first person in the home was an adult? And it seems like adults are more infectious than kids are, right? So if the kid gets COVID, they're less likely to give it to some of the other people in their family than an adult would. Again, this information, this is still evolving. We may get more information that contradicts this, but this is kind of the information that we have available now. Notably, there was a real difference depending on the age of the kid. So children under the age of 10 seem to be less likely to get COVID and less likely to give COVID to somebody else than kids between the ages of 11 and 19, right? And young adults, particularly kind of late teenage into young adults up to age 35, that's the group that actually seems to be really driving community level transmission. And so, in terms of what this means for us for school reopening is that we may need to think about schools differently from one another, right? Like maybe it's okay for us to open elementary schools because those young kids are less likely to get COVID and to transmit it to one another. But maybe high schools, colleges are not such a good idea because the kids of those age groups and young adults of those age groups seem to be much more likely to kind of get sick and be able to give it to other people. So this would suggest that we might want to think about, some kind of different strategies, right? Of maybe opening preschool, kindergarten, elementary school, but doing middle school, high school, and colleges online or as much online as we can think about. But, some people have said like, well, not everybody has access to good internet to be able to do that. And fair enough. So one idea actually that I saw circulating on Twitter the other day was, well, why not think about, rebooting something like a PBS, right, and creating robust education for kids distributed via TV. Maybe this, would be easier for people to access. It's more equitable. It's more likely that people will have, basic cable than internet, particularly as we're talking about folks who are really low income or, maybe live in a rural area and don't have such good internet connectivity. So some interesting ideas for us to think about. Would love to see more information about if there are, school districts that are starting to explore this stuff. So if you've got ideas, drop them in the comments. We'd love to hear from you. But I think the most important thing to know right now is that if you are a parent who's trying to make a decision about school this coming fall, if you're feeling frustrated, if you're feeling overwhelmed, if this feels like an impossible decision, know that you're not alone, and know that you ultimately are going to be the person who's able to make the best decision for your child and your family. And you shouldn't feel any shame around doing what you need to do to keep your family safe. So with that said, we will be, again, taking a little break for the next couple of weeks, but we'll be back at you in September. As always, send in your comments, your questions. We'd always love to hear from you. And in the meantime, stay safe, take care of each other, and we'll talk soon.